let me introduce myself first. My name is Dr. Ali Munim. I'm a medical doctor, and I used to be a specialist in related field of neurology and psychiatry. Caregiver always gonna feel some kind of depressed mood or burned out after some while, because psychiatric patient or people under mental health, they have behavior which is uncontrollable. Like, for instance, some of them can have hallucination moments where they have like different type of bizarre movement or bizarre thoughts. Like, for instance, I remember one of the cases I was managing. He have like thought that he has a pain in his back, he cannot walk. He is completely intact. One time I told him like to do certain movement, and then I tried to convince him, even I shout him that he is completely intact and he is like so, and then I push him to go out, and then after that, oh, I'm really healthy, nothing wrong. So this is one of the things we should be aware of. So to develop some kind of emotional connection, first of all, the caregiver must try to understand one thing, that it is a normal human, normal patient. You need to have kind of empathy and some kinds of emotional connection. And believe one thing, try to treat him as a friend, as a family. If you are a professional caregiver, a profession, not a family member, and try to have understanding and awareness for the disease. So please try to read about the disease. If it is like schizophrenia, if it is like bipolar depression, if it's like mania and anxiety, even some bars of phobia. So that it is. So this is one of the strategy you should try to be aware on. Or overthinking. Why don't you, in the end of the day, write down your own thoughts or whatever you did from all the day, and try to walk, try to write the positive things and praise yourself and the things you should be improved, and just read it to me and we discuss with it. And then you do 10 push-ups, and then after 10 push-ups, train 10 pull-ups, or train 10 body improvement movement or something like this. I am implicated and involve some sports and physical activity. He's actually getting improved. Maybe I'm not gonna say 170% than of caregiver, because his caregiver is always working according to routine, according to program. Some people have like some kind of, we can say, skepticism towards mental ill person. Do you think that he's gonna be dangerous, he's gonna be aggressive, he's gonna hurt them, he's gonna have like suicide, he's gonna do those types? Let me be honest, not in all cases it is true. If you see some mental ill patient and have someone with them, of course he's under control, under some kind of medication, because those who have self-harming ideas, in general, they be like in a hospital or in psychiatric illness for some time or some regulatory time and some kind of medicine. So, but the thing is, the most awareness everyone in community should try to understand is one thing, that those people are normal humans like us, normal patients like us. If you see someone who have patient with heart disease, it's like chronic disease. Mental illness can be chronic. The same as blood pressure, the same as hypertension, the same as heart condition. So it's chronic disease and is under control. Also, there is a stigma and prejudgment for the caregiver. The caregiver is also someone who's like low educated, or someone who doesn't have good social positions, which is not true. People who work in assistant or caregivers, they have like some training. Some of them, they go through medical school or have like become like nurse or under nurse education, and of course they have certain degree of education. Over criticism can increase mental illnesses. Like, for example, if you're gonna criticize someone, there's a difference between criticize someone who's like very strong. Like, for example, if you criticize me, yeah, I know how to answer back. If it is positive, I will be happy with it. If it is negative, I will try to analyze if you are right, if you're wrong. But when you do this with someone who has mental illness, behavioral disorder, they can take it as some kind of inferiority complex they have, and then they increase themselves, low self-confidence, they may cry, they may be depressed more. So please be aware. You should give a praise. You are good, you're doing good, you look good. If you're gonna criticize someone, you must be aware of his mental issues. Then you can give a message in the end, you go good, but if you do this more, you will be much better. This is called the positive criticism. Because over criticism or see someone, he has a complex, he has like many of the diseases, it will not be positive. Meanwhile, it will be a burden for the caregiver. Like, for example, the caregiver now will have extra duty, because when he has a case and this case is feeling bad, feeling more depressed, he will also get more burden, more burned out, and he can leave it. And of course, it's going to be a problem, because patient always have an emotional connection with his caregiver. Changing between caregivers is not positive. So if you're going to criticize a behavior of someone you really think is not normal, try to do it with an indirect way. Give a praise, talk very good about them, give a lot of positive things, then try to give a message. You should improve yourself if you do this. You should be improving if that. It is how to connect the doctors, how to have a good connection with a specialist. And if the specialist was not helpful, please try to address and find different one. And please try to think that this patient, if he's not the first degree relative, consider him a first degree relative of yours. So the thing is, we need to change the community way of thinking towards the people who have illnesses and the caregiver. So please, in your life, if you meet those people, try not to criticize, try not to judge, try not to give a direct or attacking advices. Some people, even normally between friends, some people, they always accept opinion and they don't care when someone is strong or something. Some people take it as if there is something less about them or something different about them, or they are weird or they are different, and then they will take the advice that is an insult and become sad, especially mental illness. So please try to understand one thing. We are not perfect.